My name is Jenna Byrd, and I'm with Auburn University, and today I'm going to be going through a whole head-to-toe assessment. Here with me I have my brother, Ryan. He's going to be my patient. So before we came into the room, we got his vital signs, his height, and his weight. I also did a visual acuity test by using the Snellen chart, and he had a 20/20 vision, so we're good there. So we're going to go ahead and start. So Ryan, my name's Jenna. I'm going to be doing a head-to-toe assessment on you. So first I'm going to start by just looking at your skin. So if you don't mind taking off your shirt for me, just so I can look over your skin. Okay, so first thing I'm noticing is it is appropriate for color. There's no discolorations really anywhere. I do see some macules noted on the body, but they're evenly dispersed throughout. I noticed it here on the freckle or the face and the nose as well. I do see some scarring here, maybe where it looks like you have some removal of moles or something of that nature. The skin is not dry. I see no rashes. It looks like it is appropriate for temperature and moisture. So now I'm going to touch it to verify that. Yes. So it is warm, it is moisturized, it's not cold or clammy or dry or scaly. Okay, good. So now I'm observing respirations. He looks like he's having an ease of breathing. It doesn't look like it's hard to breathe for him. His chest is rising and falling equally, symmetrically with every respiration. Alrighty, very well. So now I'm going to look at your head. I'm going to touch around and feel around. Okay, is that okay with you? Okay. So I'm looking here. Okay, I do not feel any lumps, any lesions, or any masses. Also, the hair is evenly distributed and is of good texture. So now I'm going to move down to your face, okay? You let me know if anything's tender. Any tenderness? Okay.
No.
I'm going to palpate your sinuses, okay? Let me know if you're tender. Any tenderness there?
No.
Okay. So no tenderness or anything noted. There's no lesions, no rashes, no open bumps or anything like that. I don't see any acne, no scarring really, except for this little bitty one. Probably got a skin removal. Okay. As I'm looking at him also, I see the eyes are symmetrical throughout the face. They are very equal in line. The pupils look like to be the same size. The eyebrows, they are of nice color. They're not dry or scaly or anything. The eyelashes, they are as well. There's no scaliness going on there. They do not protrude inward or outward. They are perfect. And then I also noticed the ears, they line up symmetrically on both sides. The septum is midline, as well as the trachea is midline too. Okay, good. So now we're just going to go to your ears. I'm going to look at them and see what I see. All right, first I want you to let me know if anything is tender to you. Okay, so the trachea and the tragus and the auricle are both non-tender. I'm going to look in here. Okay, good. So I see a pearly white tympanic membrane. There's no fluid, no redness or anything noted. There is some serum as well. Let's see. Okay. Same here. Pearly tympanic membrane. No fluid noted, but there is some serum. Okay, good. So now we're going to move to the eye. So I just want you to look up for me, and I'm going to look in here. Okay, so sclera is nice and white. The conjunctiva is pale, or not pale, it is pink and moist. I do not see any lesions or any hemorrhages or anything of that nature. All right, so now we're going to do pupillary response. So I just want you to look straight forward at me. Just focus right here on my chest. Okay, so I'm going to look here. Good deal. Okay, so we have a direct and consensual pupillary response. Alrighty, awesome. So now I'm going to go down to the nares. I want you to occlude one side and breathe the other. Good. Other side. Good. Okay, so patency of nares as well. Alright, now just look up, and I'm going to look up in them. Okay, good. So the mucosa in your nasal cavity is very pink and very moist. I do not see any drainage or any irritation of the nares. So I want you to open your mouth, and I'm going to look inside. Good. Okay, can you move your tongue side to side for me? Good deal. Okay, bottom of the tongue looks good. The roof of the mouth, the soft and hard palates look great. I don't see any lesions, any ulcers. There's no real redness. It is pink and it is moist. Your mucosa looks great. Okay. Good deal. So now we're going to look in your eyes. So I just want you to look straight forward, and I'm just going to shine a light in there and just see what I see. Okay. So I see a nice red reflux. I do not see any hemorrhaging or anything that would be abnormal. Same thing here. I don't see any hemorrhaging or anything. I see a nice red reflux, and I see the veins, but that's pretty much it. Alrighty, so now we're going to check cranial nerves. This is fun. So I want you to close your eyes, and I'm going to lift something in front of your face, and you're going to tell me what it is.
Looks like alcohol.
That's what it is, an alcohol swab. Very good. Olfactory nerve is in check. So now we did your visual acuity by doing the Snellen's chart. Now we're going to do your extraocular motive. So that's going to be 3, 4, and 6. So I want you to just follow my finger. Do not move your head. Okay, good. So cranial nerve 3 is intact, the extraocular motives, and the accommodation as well is intact too. So then we're going to try the trigeminal. So we're going to palpate on your face right here, and I just want you to open your mouth for me. Good, good. I don't feel any TMJ, no crepitus sound. Now I want you to bite down real hard. Good, strength is good. Alrighty, now close your eyes for me. I'm going to touch your face. You tell me when I'm touching it.
No. 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 No.
Okay, good. Sensation is there as well. So trigeminal is intact. Now we're going to go to the facial movement. So I want you to smile real big. Blow up your mouth like a fish. Good. Raise your eyebrows real big. Good. Cranial nerve 7 is intact. Now we're going to go to the acoustic nerve, cranial nerve 8. We're going to do the Weber test. So what I'm going to do is I'm going to strike this, and it's going to vibrate, and I'm going to put it on your head, and I want you to tell me if you're hearing it in both ears, okay?
Yes.
Hear it in both ears? Perfect. That's what we want to hear, lateralization. Alrighty, now next thing I'm going to do is I'm going to strike it, and I'm going to put it behind your ear on this little bone, and you're going to hear it, and you're going to tell me when you stop hearing it. And then I'm going to move it in front of your ear, and you're going to tell me when you stop hearing it then, okay?
Okay. Okay, I stop. Okay, stop.
Good. Alrighty, awesome. So that is what we want. We want the air conduction to be greater than the bone conduction, so that is completely normal. I would do it in this ear, but for time purposes, we're going to just do it in that one. Alrighty, next we're going to try is the spinal accessory nerves. So I'm going to put a little resistance on your shoulders, and you're going to push up for me. Good, good. Alright, now same thing with the neck. I'm going to put a little resistance, and you're going to pull back forward. Good. Other side. Good. Okay, that's cranial nerve 11. Alrighty, we gotta do the cranial nerve where we say ah. So I want you to open your mouth and say ah for me. Okay, good. The uvula is midline and it equally rises when you say ah. I would check a gag reflex at this point, but we're not gonna make you gag, so we're not gonna do that. And then we need to do cranial nerve 12, which is the hypoglossal, and that's the movement of the tongue. But we've already done that, so we're good there. Okay, good. So your cranial nerves are intact. Okay, so now we're going to move down to the throat. So I'm going to look at your thyroid. I'm going to palpate here, and then I'm just going to let you just swallow for me. Good. I'm just placing the trachea midline, or a little off the midline. Okay, I don't feel any nodules. I don't feel any enlargement. I do not see any jugular distension or anything like that. I'm going to just palpate your carotids right quick. Good. They're strong and bounding. Good. Alrighty, that feels good. Next, I'm going to check out your lymph nodes, okay? So you let me know if you see any or feel anything that's tender to you. Alright, so that was your occipital. This is your post-auricular. This is your pre-auricular. Your tonsillar. Submandibular. Submental. We have your post-cervical, your pre-cervical, And then your supraclavicular. Are any of those tender to you?
No.
Okay, good. Well, they're not enlarged, so that is great. So now we're gonna go to, I guess, the lungs and the heart. All right. So what we're gonna do now is I'm going to I'm looking, obviously we've already said that it's rise and falls equally, symmetrically with each breath. So now I'm going to do what we call diaphragmatic excursion. So I'm just going to do a little test here. So if you'll just kind of turn that way for me, I'm going to get on your back. Perfect. Alrighty, so I want you to take a big breath for me. Good. So I had equal rise and fall throughout. They were symmetrical. There's not one lung that's moving more than the other. Good. Alrighty, so now I'm gonna palpate throughout here, and you just let me know if you feel any tenderness. Okay, now we're actually gonna do 99. So say 99 for me.
99, 99, 99, 99, 99, 99.
Okay. Alrighty, I felt no tactile firmness.
99, 99, 99, 99, 99, 99.
Okay, no tactile firmnesses as well. Alrighty, so now I'm going to percuss, actually. I'm going to percuss. So I'm just listening for any. No, okay, good. And do the back as well. I'm going to check for CVA tenderness too, so you let me know if this hurts. Okay, no CVA tenderness, that's just looking for any sensitivity of the kidneys. Alrighty, so now we can listen. So I'm going to listen here. Just breathe normally for me. Okay, no adventitious sounds heard. I need you to take a deep breath. Okay, good. Lung sounds are clear bilaterally and throughout all lung bases and apices. Alrighty, so now we're just gonna listen to the heart. So first I'm looking for any pulsations that I see visually. I do see a little bit here in this carotid, but that is normal for a fit young adult. So I'm gonna feel here to see if I can feel the PMI. Very slightly I feel it. Very slight, very faint. Sometimes it's normal not to feel it at all. Alright, so now I'm going to listen for your heart sounds. So you just breathe normal. I'm listening at the apex, or not the apex, but the apical pulse, or not apical pulse, the aortic. Pulmonic. Herb's point. Tricuspid. And then the mitral. Good, there's a strong S1, S2. There's no gallops or murmurs or any abnormal heart sound. So I'm going to listen with my bell now. Okay, I heard no bruits. Since I'm here, I'm going to listen to the carotids as well. Okay. Good. So good to, I'm going to listen with my bell as well, sorry. No bruise heard at any point. Everything is 2+ and bounding. I hear no gallops or abnormal heart sounds. They're all S1, S2. Alrighty, so now I'm just going to check your pulses out. So I'm going to feel the radial. Good. And for your brachial. Good, 2 points. We've already felt this. So I'm going to ask you to lay down. We're going to move to your stomach at this point too. Alright, so we've done the radial, we've done the brachial, we've done the carotid, so I'm going to feel the femoral. Good, strong femoral pulses. Alright, now we're going to feel the popliteal, so I'm just going to lift your leg up here. You feel right here. Good. And of course, I would do this without pants, because it's hard to feel through pants, but for this video. Perfect. Okay, great. Alrighty, and then now I'm going to feel the post-tibial. Good. Good. I'm going to slip off the shoes so I can feel the dorsalis pedis. Okay. Okay, so good dorsalis pedis. Okay, good. While I'm down here, I do not feel any peripheral edema or see any swelling noted in the legs. Okay, awesome. So now we're going to look at the stomach. So I'm just looking here. I don't visually see any peristalsis or abnormal pulsations here in the aorta. So looked over, I do see some macules, but I don't see any scarring or any lesions or anything like that. Any masses, no abnormal lumps or bumps. Alrighty, so we've done the inspection. Next we're going to do auscultation. So I'm going to listen here for any bowel sounds that I might hear. So all 4 quadrants. Listen to your right upper. Good, I hear bowel sounds. The left upper. Hear some gurgling. Let's do the left lower as well. As well here. Okay, while I'm listening, I'm also going to listen to your aortic, your iliac, your femoral, and your renal arteries, excuse me. Okay, listen to my bell of my stethoscope. No bruise heard. Listen to the renal. Good. No bruise. No bruise. And then the femoral. No bruise. Let's go over here. Good, no bruise heard anywhere. Alrighty, so we've auscultated. Alright, next I'm going to do a little light palpation. Well, actually, we're going to go ahead and do percussion here. So I'm going to percuss, actually, let's do a little light palpation. Anything tender to you at all? You having any tenderness?
No.
Alright, so we're going to percuss the size of this liver. We're going to, the liver span, so I'm going to start here. Okay, so that's where it ends. That is a normal size. It's about 4 centimeters, and then we're going to do the spleen as well. That is a normal size as well. Okay, great. Alrighty, so we've done those. Now I'm going to begin a little palpation here, try to see if I can feel some of these organs that are underneath. Alrighty, so I'm going to do a little bit deeper this time. Okay, so I feel the base of the liver. Do not feel the spleen, but that is normal if it's not enlarged. Feel the bladder. Okay, good. No rebound tenderness noted. You don't have acute appendicitis. That is good to know. Alrighty, so we've done that. I've auscultated, I've percussed, I've felt. Okay, good. So next we're going to go down to the fun part. We're going to do the musculoskeletal. So I'm going to check out the hip function here, okay? So I'm going to ask you just to keep this leg straight, but I want you to raise it as far up as you can. Perfect. All right, I would say that's full range of motion on this left hip. All right, now do the same thing with this leg. Perfect. Full range of motion on the right hip as well. Okay, awesome. So next I'm going to bend your knee up here, and I'm going to check stability of the knee. So I'm going to do Lockman's test to check the anterior cruciate ligament. So I'm just looking for any shift, and it feels very stable and good. Next, I'm going to check out the meniscus area, so you let me know if anything's tender to you. Okay, I do not feel any crepitus or anything like that. Next, we're going to pull you out and do the other side as well. Let me walk the bed back so I don't bust my butt. Okay. Alright, so I'm going to bend up your knee again and check out the anterior cruciate ligament. Looking for any instability here. Hold. Good. Feel a little movement, but not too bad. And if I'm not mistaken, you've had surgery on this knee before.
That's correct.
Okay, I thought so. Now we're going to go up. So if I'm hurting you at any point, you just let me know. Okay. Little crepitus found, but not abnormal with someone who's had surgery before. Okay, push the knee back. Okay. Alrighty, so now I want to do a sensory test. So I'm going to just pull up here, which I really don't have to pull up. Never mind. We're not going to pull up. We'll just do it for this test. Alright, so I want you to close your eyes, and I'm going to touch you on your leg. You tell me when I'm touching and what leg I'm touching, okay?
Okay. Right. Left. Right. Left. Right arm.
There you go.
Left arm, excuse me. Right arm. Right arm. Left arm. Right arm.
Good. Okay, sensory is intact there. That is very, very well. Alrighty. So we've done the knee stabilization. Checking out your ankles here. I don't see no popping felt. Good range of motion. Alright, so while I've got you like this, I'm gonna rub this on the bottom of your foot. Can you feel it first of all?
Oh yeah.
Good, okay. Are you ticklish?
Mm-hmm.
Okay. Alrighty, so we got that. While I got you laying down, I'm going to give you an object, and I want you to tell me what it is, okay? Close your eyes for me. Hold out your hand. What is this object?
Feels like some tape.
Feels like some tape. Well, that is exactly what it is. So your stereogenicity is in, or stereogenesis is in tact. Okay, good. So we've got the legs, got the knees, got everything else. Alright, I think it's time to stand up now. Well, actually, let's do your reflexes. So you can just sit on the side of the bed, but keep your feet hanging off. Yeah, just rotate knees like that, and just relax them knees for me so we can do this here test. Alrighty, perfect. Yeah, you can just hold like that and just relax. It's all good and good. Alright, so I'm going to sit right here with the point, and I want you to see if we can... Ah, there it is. Okay, now let's do this side. Alright, relax this knee. There we go. Oh, how's it going? Okay, good. Now I'm going to do the Achilles as well. There it is. Can you relax for me? There we are. Okay. Okay. You can put these down now. Alright, so we're going to do the bicep and the tricep one as well. So I just want you to hold your arm here. Ooh, there it is. Okay, now we're going to do the tricep. So you just let me hold it. Okay, now we're going to do this arm. So here. There we are. Okay. And then this tricep. except here. There we are. Okay, good. Good deal. Okay, so we've done the reflexes. Now I think it's time to stand you up. So let me give you your shoes so you can put them on so you're not walking around with me. All nasty like. Okay, so first thing, I wanted to see you walk. So just go over there and you're gonna walk to me, okay? Just walk normal. Okay, gait is good. I do not see any limp or anything like that. He's not off balance. He is steady. All right, good. Now I want you to do a heel to toe, just like a sobriety test. There you go. Perfect. No unsteadiness, no nothing. And then you can walk on your tiptoes on the way back. Good. Good. Alrighty. Coordination is there. And you're not having any limps, no pain when you're walking. There's no asymmetrical activity going on. It's all proportionate and good. Alrighty, so now we're going to check out the hips, the range of motion of the hips. So I want you to stand with your feet by your side. And then I want you to, from this leg, kick it out. Can you kick it this way? There we go. Kick it forward and backwards. Okay, and then do it with the other leg as well. So you're probably going to need to turn. There you go. There you go. Uh-huh. And good. Okay, so we did all that. Alrighty. Now we're going to do our hands and our shoulders. So just hold out, side to side, back to back. I want you to bend straight. Try to touch your toes. If you can't touch them all. Okay, good. At this point, I'm looking, palpating the spine. I do not see any scoliosis or any curvature of the spine, so that's good. Okay, so we've done that. Any shoulder, I don't feel any crepitus. There's definitely no limited range of motion with this shoulder. A little crepitus right there, but that's okay. That's that throwing arm. We're okay with that. Okay, so now we've done that. Let's do these, extension, flexion, good. Now radial, dorsal, palmar, good. Okay, now I'm gonna squeeze this hand. Squeeze this hand. Okay, good. Equal strength in both hands. All right, now I want you to push out on my hands. Good, equal strength. Woo. All right, now pull. Woo. Good strength, good strength. Okay, now I want you to put your hands out straight. I'm gonna push down, don't let me push. Good. Now I'm gonna push up, don't let me push. Good, okay, awesome. We're gonna do that with the legs too. Okay, so we've done those. Strength. Now we're gonna do hands, so just flare out your hands, good. Now ball them up like a fist. Okay, cross, yeah, just all around, okay. And then wrist, good. So there's no limited range of motion at all. Any carpal tunnel problems or any numbness or tingling in the fingers at all?
No.
Okay, good. All right, I think you can have a seat now. We're gonna do coordination. So I want you to touch my finger and then bring it back to your nose and just keep doing it until I say stop. Good. Okay, so coordination is there and it is intact. Alrighty, and then I wanted to do something with the legs, but I can't remember. Yeah, that's what I wanted to do. Alright, so I'm going to provide some resistance and you push up. Good. Now you pull back. Good. Now push up. And pull back. Good. Okay, so all the strength in your musculoskeletal system looks good. The arms are equally proportionate and displaced. They're very, very nice. It's weird because you're my brother. Okay, so the hands are good, the musculoskeletal is good, the feet, we walked. Alright, so now I forgot one little test. It's called a whisper test. So I'm gonna go behind you and I'm gonna whisper something and you tell me what you hear.
1, 2, 3.
Correct. Now the other side.
1, 2, 3.
That's it. Okay, I thought I was going to trick you. Alrighty, and then we'll do a quick peripheral vision assessment as well. So you just look straight at my nose, and then you let me know whenever you see my finger. Okay?
Alright.
Okay.
Alright.
Good. Okay, peripheral vision is intact as well. Okay, Ryan. Well, I think we did a pretty thorough physical assessment here. I did not find anything that was abnormal. I think you are good. Any bowel or bladder changes in you? Okay. Okay, good. We did the CVH tenderness. We did all that. Okay, I think we are, no, we didn't do Romberg's test. Stand up for me. Okay, so I want you to just stand on one foot, eyes open. Okay, now I want you to close your eyes. And, yeah. Okay, no swaying or anything noted. Now do the other foot for me. Open. And then close with one eye. Yeah. There we are. Okay, no swaying or anything that I've noted.